organizations, the difference that you make in the community, whether it's championing civil rights, whether it's being mentors to young ladies, the work that the AKAs do in our schools, in our community. I really appreciate it. Thank you very much for hosting this evening. How's everybody doing? All right. Great. It's great to be here this evening, be able to spend a little bit of time with you. I hope to keep my remarks brief because I want to open it up for questions so I can make sure that we are speaking to the issues that are important to you. You know, I'm about a generation removed from poverty. My father was raised in Kingston, Jamaica, in a poor neighborhood called Jonestown. He was raised by his grandmother in a very loving, caring home. It was a one-bedroom home with a dirt floor, and it was tidy and it was neat, and there was a lot of pride in that house, and it was surrounded by a community full of hardship and poverty, illness and disease, much of which never went treated. And when my father was a little bit older than my son Jonathan is today, he wrote a letter to his mother, my grandmother, who was already in this country. And he said, "Mom, bring me to the United States. So I want to go to college." He saw a lot of sickness. He said to his mom, he said, "I want to heal people. I want to be a doctor." My grandmother wasn't a wealthy woman. I know my good friends Delegate Nat Oakes and Senator Gladden, they've heard me share this story because it's this story that has inspired me to public service. My grandmother was a domestic servant. She worked for wealthy families. She helped raise their children, prepared meals for their families, and cleaned their bathrooms. She was a proud woman without an education, but she knew the importance of an education, so she saved her money. And she brought my father to this country. He was the first in our family to get a college education. And then he spent his entire life, after graduating from medical school, he was a family doctor, seeing patients, treating people in some of the poorest neighborhoods and hospitals near where I grew up when I was a little boy. My father loved his patients. What he didn't make in salary, although we were comfortable, was made up for the satisfaction he got knowing that he made a difference in the lives of his patients. I knew growing up that I wanted to be like my father. He taught the lesson of service, of neighbors helping neighbors, and taking care of others, particularly those who were in need. So I didn't go to medical school. I went to law school. But as a lawyer, having spent 30 years in the Army on active duty and in the reserves, as a member of the General Assembly, and most recently 8 years as your Lieutenant Governor, I've had the opportunity to work with communities around Maryland, around the state, as we have fought to build the best schools. And we know that work needs to continue, because not every child today yet is in a blue ribbon school, so our work continues, and that's why we invest the $1.1 billion in the Baltimore City schools to replace and renovate 35 schools by 2018. We've got some of the best hospitals, not only in the country, but in the world, deliver outstanding medicine and discovery, like at NIH in Montgomery County. Yet our work continues because we still have some Marylanders, whether by race, ethnicity, or geography, aren't getting the same health care and living the same healthy, quality lives as their neighbors. So this is a great state, and we've made a lot of progress. But I'm running for governor because, like you, I believe that we can build a better Maryland, and we've got to build a better Maryland for more Marylanders. Because each of us contributes to the greatness that is this state, so each of us should benefit from the greatness that is Maryland, because Maryland is a great state. I'm happy to be here this evening, to be in a conversation with you about how together we can build a better Maryland for more Marylanders. So with that, let me stop. Anthony promised that he had a whole bunch of questions, and I hope that we can get to as many of them as possible.
In a senior center, what is your platform to do more for seniors in the state of Maryland?
Sure, there are a number of things that we can do for seniors. And you know, it's interesting because a few years ago, when I visited a seniors center, I started talking about a lot of issues that are somewhat unique to seniors, and one of the seniors raised their hand and said, "Young man, will you stop talking about seniors? You're making me feel old. I want to hear about education because I got grandchildren. I want to hear about jobs because I got children. I want to hear about safe neighborhoods, which isn't a senior issue, but it's an issue that affects each and every one of us." I said, "I got your point. I got your point." But look, there are a number of things that we need to do to ensure that we are supporting our seniors. These are men and women. These are Marylanders, our neighbors, who have already contributed so much and have many more years to go to continue contributing. That's why recently I proposed an affordable housing plan in Maryland. Many seniors struggle with affordable housing as they go from an income to a no income or a flat income that may only be Social Security. And we have a demand for affordable housing, whether it's seniors or military, veterans, workforce housing, and seniors are acutely impacted by this. So I've rolled out a plan for affordable housing to invest more dollars that we can use, public dollars, to leverage private sector investments to deliver more affordable housing. And seniors are a big piece of that. Look, we just implemented the Affordable Care Act. And you remember years ago where we were wrestling with the Medicare prescription drug Part D program that left that gaping hole for seniors? Remember? So seniors, for the first few dollars they spent, they only paid a copay, but then they got to a certain point where they had to pay all of it, until they reached a higher level, they got back to the copay. That donut hole was very difficult for our seniors. So as part of the Affordable Care Act, see, often lately what we've been reading about in the Affordable Care Act is a broken website. But let's not lose sight that the Affordable Care Act has delivered so many benefits to so many Marylanders. Parents who can no longer be denied coverage because their child has a pre-existing condition or they're no longer paying through the roof. None of us can be thrown off of health care because of our claims history. Well, for seniors, and we embrace the Affordable Care Act, one of the important protections is to close that donut hole in the prescription Part D program. Look, I see an opportunity for seniors, whether it's working with the AKA, the NAACP, or the Governor's Office of Volunteerism, to engage seniors, to work and give back in our schools, in our communities, to use their talents and their skills to continue making a contribution to Maryland. But one thing I know for sure, regardless of the age, and I learned that a few years ago, I told you from the senior who reminded me not to remind her that she's not as young as she used to be. Marylanders all want the same things for themselves and their families: safe neighborhoods, great schools, a clean environment, and access to affordable, quality medical care.
Thank you, Lieutenant Governor. Your administration touts its commitment to minority-owned businesses in Maryland and in the city of Baltimore. I'd like to know specifically what you will do to increase that number of minority-owned businesses, because we know they still need support.
Absolutely. Great question. Maryland is home to perhaps one of the most diverse business communities. We have the highest, or one of the highest, percentages of women-owned businesses in Maryland, and that's true for African-American owned businesses. And these are businesses in all sorts of industries, from the retail side, cosmetology, in the hospitality industry, the construction industry, in cybersecurity, and the life sciences. A very dynamic, capable business community. The governor and I recognized that 8 years ago. And when we took office in our Minority and Women Business Enterprise program, we had the structure in place for a good program, but we didn't have the leadership, the will to make that program work. So 8 years ago, we were doing contracting with the women and minority business community roughly at about $950 million a year. Today, we're doing contracting with women and minority businesses closer to $1.5 and $1.6 billion a year. And in the African American business community, the Latino business community, the Asian American business community, and women-owned businesses, we have seen increases, dramatic increases in the percentage of contracts that are going to them. How did that happen? A few things. See, sometimes contracts come before the Board of Public Works and they have a goal of 25% MB participation. And the agency says, well, we want a waiver because we can only come in at 2%, 3%. Well, early on, the governor and I said, that's not good enough. We said to the agency, go back and take another look. There must be women and minority-owned businesses that can do some of the work of that contract. Lo and behold, When you start sending contracts back to agencies and you start slowing things down like that, you get a lot of people's attention. The number of waivers that we grant are considerably lower today than they were 8 years ago. Didn't need to change the law. We had to change our focus and our emphasis. We've done a few other things. 8 years ago, the MBE program didn't even apply to school construction. It's our second biggest capital investment program in the state of Maryland. Today it does. We did some more things. We passed a law and required the Public Service Commission that regulates our utilities enter into a memorandum of understanding with the regulated utilities, BGE, PEPCO, and others, and have them embrace the MBE goals. Now, we don't count those towards our 25%, but one thing we do know is now our regulated utilities are doing more business with MBEs in the state of Maryland. So 2 years ago, for the first time, we hit our goal of 25%. We hit 25.6%. And by a show of hands, does anybody know what you do when you meet a goal? Clap. You clap, and then you raise the goal. You raise the goal. So today, the goal in Maryland is 29%. So we've got opportunities to do even more business with women and minority-owned businesses in the state of Maryland. That's the commitment that we demonstrated 8 years ago under a Brown-Olman administration. That's the commitment that we will continue to make in the next 4 years.
The questions are getting just a little bit tougher, Lieutenant Governor. You have proposed to create a dream fund for those who have come into our state illegally. If elected Maryland's next governor, what would you do specifically for African American children that are here legally who cannot access adequate funding to attend college?
I like the question. I like the question. See, I shared with you my family's journey to America, and I told you that I'm a first-generation American. I shared with you a little bit about my father. Often when we think about immigrants, whether they've come to this country a year ago or a century ago, whether our families came here involuntarily or by choice, we often think about immigrants from the standpoint of what do they want from America? Because America's great. What do they want? What benefit do people want coming to America? That's a reasonable question. I think that kind of is the gist of the question there. But there's another aspect that we have to embrace and appreciate. That no matter when your family came to this country, and whether it came here voluntarily or by force, each of us has an opportunity to make a tremendous contribution in the greatness that is America. And I think everybody in this room would agree that give a young person an education, a quality education, K through 12, an opportunity to go to college or get some advanced skills training so they can get a good family supporting job. I think everybody in this room would say that's what we need to do for Americans new and old. And that's what the Dream Fund does. It says we have students who are in our country because years ago their parents brought them here. They've been educated in our public schools. And now they don't want to be a drain on society, they want to make a contribution. But for many of them, even though we provide in-state tuition, they don't have available to them what many of our children have available, which are student loans. It's one thing to say that we'll lower the tuition, but if you can't take on a student loan for so many students, you can't even pay that tuition. The Dream Fund that I proposed offers student loans, not scholarships, student loans for these dreamers so they can take out a loan and pay it back at the same terms as federal Perkins loans. It's not a giveaway, it's a loan. But with that education, they're going to get a job to be able to repay this loan. And let me say this last piece on the question here. Please, 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 I ask you, do not view our community, our society, our economy as a zero-sum limited pie. There is ample opportunity for each and every one of us. African Americans who were born and raised in this country, and Nigerian Americans, and Mexican Americans who may have just arrived a year ago or 2 years ago. This is a great country. What we need to do is invest in infrastructure to create jobs and grow our economy. When we invest in infrastructure, we need to make sure that there are apprenticeship programs so that we do local community hiring that benefits African American community and everyone else living in Baltimore. Remember I mentioned $1.1 billion for schools? Did I mention the $2.6 billion for the Purple Line? Did I mention the $140 million investment in the Port of Baltimore? These are opportunities. And when we create these opportunities, we need to ensure that there are local hiring agreements so that the residents of Baltimore City will benefit. Whether you're African American, Mexican American, whether your family came here this year or last century. Thanks for the question.
Lieutenant Governor, given that marijuana is so much less dangerous than alcohol, why should marijuana remain illegal in the state of Maryland?
Let me explain my position broadly regarding marijuana laws. There are three things to sort of consider that we've been taking up in and out. One is medical marijuana, and that's where we're giving authorization to physicians and other healthcare providers to be able to prescribe marijuana for medicinal purposes. You go to some countries like Israel, they already have something like 60 different forms of cannabis. Much like in this country, you have different types of hypertension medicine, and you got to try this one, that doesn't work, so you try this one, and eventually you get the right one. Because there's so many benefits from a medical standpoint to marijuana, some states are light years ahead, some nations are light years ahead of this country. Maryland is finally on board. I supported legislation that not only authorized it, but this year made it a little bit easier to set it up where doctors can prescribe prescription marijuana for medicinal purposes. On the other side, and I mentioned there are three pieces that we look at, is the legalization of marijuana that some are calling for, where we would regulate it and we would tax it, much like we do alcohol, where we don't let underage people consume it, you can't consume it and drive, and the other sort of regulations, and then we tax it. There are two states in this nation that are already moving forward with that, Colorado and Washington. I think we ought to look closely at the experience in Colorado and Washington. One of the beauties of this country is federalism that we live in. It's democracy. It's a laboratory where states can try things, what works and what doesn't work. So let's look at what happens in Washington and Colorado and look at not just the financial benefit to the state, because they're already demonstrating that through taxation they're collecting a lot of money. But let's look at the full range of socioeconomic impacts before we make a decision whether to legalize marijuana. And then there's that third piece, sort of the in-between piece, if you will. And that's the decriminalization of marijuana. And this year, I co-authored with Joe Johns, and many of you may know him, the executive director of the Center for Urban Families. We co-authored an op-ed to the Baltimore Sun, where we forcefully said we need to decriminalize possession of small amounts of marijuana. Why? A number of reasons. One study shows that it's $100 million a year just to prosecute those cases. We could take that and invest in investigations and law enforcement strategies against more violent conduct. We could take that and we could invest in substance abuse treatment and counseling. But there's a second reason why I support the decriminalization of marijuana. In this country, we've got the best criminal justice system in the world, but it's not perfect. And in this country, African Americans and the white community consume marijuana at about the same rates. But young African American men are arrested at a significantly higher rate. There's a racial bias in the system. And what happens when they're arrested? They've got a record. And what happens when you have a record? Hard to get a job, hard to get college, hard to get affordable housing. And that's why not only did I support the decriminalization of marijuana, but I rolled out a proposal to reduce violence in our community and reduce recidivism. And in that proposal, I call for banning the box, which we've done in state government. Let's do it in county government. And the shield law to let corporations ban the box. And I'm going to end on this note. Because this is a very important note. We've got the best criminal justice system in the world, but it's not perfect. I stood with the NAACP Attorney General supports the death penalty. And when I was asked before that legislative committee, why do you support the repeal of the death penalty? I said it comes down to numbers. Here's the number. Follow me. Here's the number. Not only is a majority of death row inmates in Maryland African American, yet we are still a minority. But follow this number. 26% of the cases in this country that would be considered a capital case or a death penalty case, 26%. Delegate Sandy Rosenberg, he was the chief sponsor for this bill. 26% of those cases, there's an African American male defendant and a white victim. If you look at death row around this country, 70% of death row inmates are black men with white victims. There is racial bias in the system. We had to repeal the death penalty, and that's what we did last year. And I thank you for that. The Attorney General says it's a wonderful tool. I say ask Anthony Gray. In the 1980s, Anthony Gray, a black man in Calvert County, the prosecutor went to him and threatened the death penalty. He admitted to the crime. He spent 5 years in jail to avoid the death penalty, and then he was released. Not because he had a faulty trial, but because they found the real killer. The death penalty is an irrevocable punishment. You put people